Sir, please start.
Good evening, everybody. I'm Dr. Kankriya from Pune, the MOC for the day. The topic today is a special panel discussion with this. We are going to discuss, and the theme for the day would be: a doctor is not negligent, but if he is acting in accordance with the practice accepted as proper by a reasonable body of medical men skilled in that particular art, merely because there is a body of such opinion that takes a counter review. So we have Maha Academy Pediatrics, which presents this special panel discussion. We have experts, Dr. Mahesh Baldava, who is a senior medical legal advisor and pediatrician from Mumbai. We have Dr. Satish Tiwari, sir, professor pediatrics from Amravati. Dr. Pradeep Arora, sir, who is the consultant and general pediatric surgeon from Nagpur. And the moderator for the day today is Dr. Hemant Gangolia, sir, who is the past president of MAHAIAP 2022, pediatrician and a medical legal consultant from Raigad. So, may I request our president, Dr. Sanjay Pakmade, sir, to take over and give his words for the day.
Dr. Shirish, Dr. Pakmade sir is unfortunately in traveling. So
Okay.
He is not able to join. So
May I request Dr. Amol Pawar, sir, to go ahead?
Yes, sir. Shiri, sir. We'll request Dr. Pukhraj Bafna, sir, to first comment and then I will do. Sir, so respected Padma Shri Dr. Pukhraj Bafna, sir, please have your words with MAHAIAP on this occasion.
Dear friends, it is a real pleasure to see you again. Yesterday I was there and I was so happy to be with you all. And I know Dr. Baldua very well. We were good friends, and after a long time I'm seeing him. But this topic is really need-based and problem-oriented. And every not only pediatrician but every medical man needs to know about all these things, because we are not trained for this, but we are facing these problems. That's why, and a person like Dr. Baldua, he is the doyen of the topic, let me say. So welcome to you, sir. And
thank you, sir. Thank you.
I really enjoy these topics as well as the conference. Thank you so much for giving me this honor. Thank you so much.
May I request Dr. Amol Pawar, sir, to have a few words?
Thank you, Shirish, sir. First of all, I welcome respected Padma Shri Dr. Pukhraj Bafna, sir. Then today's all the expert galaxy of panelists, Dr. Hemant Gangolia, sir, past president, Maharashtra IAP and senior pediatrician and medical legal expert. Also, Dr. Pradeep Arora, sir, from Nagpur, Dr. Mahesh Baldava, sir, from Mumbai, and our own, very own senior pediatrician and medical legal expert, a multi-dimensional personality, our own Dr. Satish Tiwari, sir. So we all know they have done a lot work about on child healthcare and overall, not only child but overall medical healthcare. So today's topic: the bench, the bedside, and the legal shifts in healthcare. They have chosen a very good topic on this occasion, and everybody is eager to hear them all. So without wasting time, I will request Dr. Shirish sir to call Dr. Sanjay Deshmukh sir and then go ahead in this workshop. So wish you all the delegates happy learning. Thank you.
May I request Sanjay Deshmukh sir, convener, to give his words?
Good evening. On behalf of MAHAIAP, I welcome all the esteemed faculties, office bearers to our MAHAIAP platform. Friends, yesterday we have started, and this weekend will be another busy academic activity on our platform. Today we are going to discuss, which is the most important topic in our day-to-day practice. Unfortunately, professional indemnity is, sorry to say, in spite of so much of the active members like Tiwari sir, Dr. Hemant Gangulia sir, Dr. Badwa sir, Dr. Arora sir, the people are not going for the professional indemnity. And the statistics says more than 5 million medical malpractices happening. And the medical legalization cases are increased by more than 400%. So today we are happy we have our own Galaxy speakers, respected Dr. Barwa sir, Dr. My guru, Dr. Satish Tiwari sir for Amravati, and our own pediatric surgeon and the renowned face of medical legal expert, Dr. Pradeep Arora sir. And Dr. Hemant Gangulia sir will making this journey, what he is making sure we have to make insights in the what is happening and how you cope with the medical cases in your day-to-day practice. So thank you and welcome all.
Thank you, sir. It's my privilege to introduce the dignitaries. Let me start with our moderator, that is Dr. Hemant Gangulia, sir. He is a pediatrician and medical legal consultant. He has post-graduated from, one moment, I just lost it again. One moment, sir. He is postgraduate from SET GS Medical College, KM Hospital, Mumbai. He is a law graduate from DY Patil Medical College, Navi Mumbai. He's practicing at Neral, Raigad, Maharashtra since last 35 years. He's been the past president of IIP, MAHAIAP 2022 and a scientific convener of IIP Medicolegal chapter from 23 to 25. And he's an editor and author of medical negligence in pediatrics. He's been the chief organizing chairperson of MAHAPedicon 2021. About Dr. Mahesh Baldava, there are multiple things which can be spoken about him. He's not only a pediatrician, he's a senior medical legal advisor. He has not only completed his LLB and LLM, he's a PhD as well in law. And hats off to you, sir. He has done his MBA and MA in psychology as well. He is a professor on law for postgraduate students at the University and Department of Law in Mumbai. Then coming to our next speaker today is Dr. Satish Tiwari, sir, who is also an MD Pediatrics and an LLB and a fellow IAPN. He is a professor and pediatrician at the PDM Medical College, Amravati, and he is a founder member of this Medical Legal Association. We have Dr. Pradeep Arora, who is MS General Surgeon and has done pediatric surgery and also a LLB, and he is a consultant pediatric surgeon at Aurora Hospital in Nagpur. Without wasting any further time, I would hand over the proceedings to Dr. Hemant Gangulia, sir. Gangulia, sir.
Okay, I think he is disconnected. There is problem in Raigad. There are a lot of winds and heavy rains, etc. So I think we let the IAP person present it. Are you there? You are not audible. You are not audible, Hemant. Hemant, audible.
Yes, I will share. Here we are having lot of rains, and therefore little bit glitch is there. So thank you, Dr. Sirish sir, for your kind introduction of all of us. And so at the outset, we would like to thank Maha Academy of Pediatrics, office bearers of Maha Academy of Pediatrics under dynamic leadership Dr. Sanjay Pakmode and scientific convener Dr. Minar Sheikh and his team to give us the opportunity to share our thoughts on this topic. Myself as a moderator, our esteemed panelists Dr. Mahesh Baldava sir, Dr. Satish Tiwari sir, Dr. Pradeep Arora sir, and once upon a time, clinic as a temple, doctor as a deity, and now in this era of consumerism, 1 minute. So in this era of consumerism, we have lots of possible consequences doctor can think of, and it is all about thinking about the courts, then the Consumer Forum, Medical Council, and now it has caused the impact on patient-doctor relationship. Faith has replaced by contract, and there are many case laws which has changed the practice. What we used to practice 20, 25 years back, it is definitely different now. Faith has been replaced by contract. One has to change with time. Mishaps are the part and parcel of our practice. We have to accept it and face it. IMA versus VP Shanta case law is broad medical profession in an ambit of consumer. Paramanand Katra case law states we don't have right to choose the patient in emergency state. Therefore, but in non-emergency state, we have the right to choose the patient. Prabha Manchanda case law is all related to all various types of consents. Hiranandani hospital case law says dead body cannot be held against pending bill. And this famous case law, which says lack of documentation of discharge card, follow for ROP, retinopathy of prematurity. This case gave 1.8 crore compensation. So documentation is very important. And this 1 crore Prashant Dhananka versus Nizam Institute Hyderabad case is all related to the cross-speciality practice. And so we should not cross our specialty while practicing. But then we should learn and get mentally prepared. This line, probably everybody knows. Ignorance of the law is not the excuse. I am not going to explain, but what I want to say is that there are a lot of gray areas. Medical legal issues are part and parcel of one's practice. One has to accept it, but one should not get afraid of it. One should always think of ways out, and one has to redefine, retrospect one's own practice in this era of consumerism. And therefore, every patient, we should be watchful. And if any complication is there, or if we anticipate, please keep the papers for the lifelong. With this background, as well as these are the two principles, Bolam principle and Bolitho principles, both legal concepts which are used to assess professional negligence, especially in the field of medicine. This is one of the case law, Bolam versus Freed Hospital Management Committee. And the another is Bolitho versus City and Hackney Health Authority. What is the difference between the two? I will request our panelist, Dr. Mahesh sir, to explain about this. Yes, sir.
Thank you, Dr. Hemant. The Bolam is used in almost each and every medical negligence judgment, and which said that any peer-approved medical treatment approach is valid even if it is accepted by the minority. That was the law when Lord Justice Denning was there. And subsequently, in Bolitho, they introduced the concept of it being reasonable and logical. So earlier, our peers were the one who set the standard. Now court has intervened. So now the court will see whatever the peers or whatever your professional bodies say, whether it is reasonable and logical also. So the courts will decide this. That is what the difference between the two.
Okay, sir. Thank you very much, sir. So while taking expert witness, we should have proper letter drafted to explain all the things, but still the court has a power to reject if there is a professional opinion. If it does not stand the logical scrutiny, even if peer supported. Moving ahead, so with this all background, now let us move to the 9 issues which are really which we practice during our practice, and the judgments are there from which we can have the lessons learned to improve or redefine our practice. And so the issue 1 is that medical profession brought into the ambit of Consumer Protection Act. And there are 2 terminologies used, contract versus torts. So in short, I will not go in the detail, but CP Act was implemented in 1986. It was implemented, amendment 2019, and there are some rules made about jurisdictions in 2021. And one good thing about that, section 76 to 81 is related to mediation, but except for death and disability. But after this CPA 2019, we had public interest litigation filed, as well as there was some recent case law of the lawyers, and there is a contest contract for medical services. So there is a difference between tort and the contract. and when one should plead that, and to know about this, because so these are the judgments which were recent judgments of the landmark judgment. Landmark judgment VP Shanta, which has brought our profession in the ambit of CPA, everybody knows. And these are the recently after the some case law of the against between the lawyers and the DK Gandhi, and this is the one more important case law is the Union of India versus NK Srivastava case law, which is regarding the free services. And but before I ask our panelist, Dr. Pradeep Arora sir, to explain all this case, what does it mean to us? And but before that, there is one important concept of contract versus torts. And therefore, I will just request Dr. Baldava sir to explain about what is a torts and what is contract and why we should plead when we file written statements or in the court of law.
Thank you, sir. Thank you very much. The very crux of the consumer is basically on the basis of contract. So there is a doctor-patient relationship, there is an implied contract. Now what happens? Having entered into the consumer domain, they start with a contract, but they land in with the law of tort. And the difference between the two is law of contract has liquidated damage, and law of tort, the court decides unliquidated damage. So most of the time it happens in the higher judiciary. Of course, High Court and Supreme Court have power to dabble into any law, but the district forum, the state commission, and the national commission, they should be restricting their activities as per the IMA versus VP Shanta. That says contract for medical services. That is the reason we are under the Consumer Protection Act. So once they said that we should tell we should move on a miscellaneous application asking the patient to refine his own complaint to fit into vendor-consumer relationship and what is the liquidated damages he is asking for. Once you have moved that miscellaneous application, if he has any doubts, if he wants to pursue with the court law of tort and unliquidated damage, etc., then the consumer forum and other higher up to national commission, they should relegate it to the normal full judicially competent bodies like civil courts. So once you ask the patient himself that he is not going to invoke tort, then it becomes crystal clear that this is what is the contract, this is what is the breach, and this is what is the liquidated damage. That at least we can do within the purview of or four corners of IMA versus VP Shanta judgment. That is my view, and I always put this. Plaintiff should specify whether the claims arising under the law of tort or claims under law of contract or as per VP Shanta, that he should very much clarify. If it is not, then he should tell that it is under the law of tort. Then the consumer forum should decide whether it should remain in within the jurisdiction of consumer or it should be relegated to the civil court for trying the law under law of tort. That is what is my contention.
Yes. So in short, take-home message is that whenever we file the statements, one can add this paragraph. We can just follow this cursor, and this paragraph can be introduced in that regarding what the allegations and according to decide torts versus contract. So
I'll just add, Hemant, the thing is that this is very short, one paragraph which just gives hint, but the real application goes into 2 pages. So we ask the patient himself to modify the same application as per IMA versus VP Shanta. We give him a chance through court that you please modify accordingly and tell us the liquidated damage. That is what we generally do. Thank you. I think there is a glitch. He is not. Is disconnected, and I think we should go to the next 3. Now, someone to move the slide because next 3 recent judgments.
Yes, sir. I'll do that.
Yeah, you please do that. The first case was filed by the Medicolegal Action Group versus Union of India on our very own Dr. Pradeep Arora sir has fought in High Court in Mumbai.
Sir, I'm
and
back, sir.
subsequently
Sir, I'm back.
you are there again. Then second was a recent case where Bela Trivedi has given
Please,
a
sir,
judgment in
Arora.
favor of lawyers that they are not within the purview of Consumer Protection Act, saying that that is a something which is contract of service. If that is a contract of service, then as per the IMA person Vivek Shanta contract for medical services, this becomes again the tricky question. And in this judgment, they were told to go for review. And so subsequently, Medicolegal Society of India, they filed a review petition, which was which said that existing judgment adequately balances consumer
Dr.
rights
Baldwin.
and professional accountability. Yes.
Yes, sir.
Are you there?
You can see me you can see the screen.
Yeah, we can see. I have described these
Yes,
three.
yes.
Now you want Dr. Pradeep Arora sir to intervene?
Yes. Dr.
You ask
Pradeep.
him.
Yes, Dr. Pradeep Arora, please go ahead with all these cases.
Unmute yourself. Unmute. You ask him to unmute. Unmute.
Can you hear me?
Sir, you someone has to phone and request him.
Can you hear me?
Yes, I can hear.
Hemant
I can
sir.
hear.
Hemant
No,
sir, you are
Dr.
audible.
Pradeep Arora sir has not unmuted.
Sir, I'm requesting him to unmute.
Okay.
Yes.
He
I have
has
unmuted. I have
Yes, Dr.
unmuted.
Pradeep Arora,
Yeah.
please explain about
Yes.
case laws.
Now, see, after this Consumer Protection Act 2019 kicked in, it is not amendment, by the way. It is a new act, de novo act. So it is not amendment. So Medical Legal Action Group, Union of India, filed a PIL, to which I believe the court took some objection because it found it misconceived. And the main plea was that the minister, late Shri Ram Vilas Paswan, on the both in the Rajya Sabha and Lok Sabha, said that this was excluded and gave the reason also that it leads to defensive medicine, a more expensive, leads to expensive investigation, etc., etc. And this was the main plea, that legislative intent is clear. So when it is not categorically mentioned in the section 2442, it cannot be assumed to be there in spite of the previous three-judge judgment in 1995, that is IMA versus VP Santa. Court dismissed it and saying that the judicial construction remains the same. Hello, am I audible?
You are audible.
Yeah,
sir.
judicial construction remains the same. No, nothing doing. It won't. And on the contrary, they slapped a penalty of 50K for the reason that jurisdiction of PIL was invoked, whereas a motive for the it is personal agenda because you are fighting for your rights. You don't want to be included in the Consumer Protection Act. So then it went to Supreme Court. Supreme Court, we also joined as SLP. Our SLP was different. Medical legal action SLP was different. IMA filed the third SLPs. All were dismissed. I can tell you about my SLP. When I appeared in front of Justice Chandrachud, he said he was already angry because 10 days back only, Siddharth Luthra had presented SLP of Medical Legal Action Group. So he said, we have already dismissed it. I said, I have additional point to make. One is that ours is writ petition, not the PIL in first place. And secondly, our additional point is, besides this legislative intent, that there are non-judicial members in the consumer fora. And this is not acceptable. This has been held unconstitutional by the multiple constitutional benches of the Supreme Court. So this problem is there. He said, okay, we can refer to this question only if individual case come. A person who is agreed, if he comes, then we can consider this question. For the time being, you people are not affected, so we will not accept this. So SLP was dismissed. This was my conversation with the ex-CJI, Justice Chandrachud at that point of time. Now, IMA also filed. Mukul Rohtgi pleaded the case on their behalf, and it was also dismissed. They filed SLP pursuant to a petition in the Kerala High Court, in which again this contention was dropped that the medical profession should be excluded. Now I have lost the slides here. Yes.
Yeah.
Now,
Central
Bar
High
Council of Indian Lawyers,
Move
GK
the
Gandhi,
slide.
you know
Central
that this is the
Liability Movement.
recent. Hello.
Yes,
This is the
thank you, sir.
recent by which lawyers were exempted from the Consumer Protection Act, saying that they are sui generis. Sui generis is just a pompous word for the unique, that they are a unique profession. They are court officers, so professions are basically not included. And judges were kind enough to say that medical profession is also a profession, and profession per se, if we look the objective and objectives of this law, these are not to be included. So a higher bench should be there to look and revisit the three-judge judgment of 1995. But then, 4 months later, this reference was examined by a constituted bench headed by the present CJI Justice Gawai, and three-judge bench, and they said that there is no need. Well, you have said the profession are that you have already mentioned in your judgment that it is sui generis, and that explains it all. It's a profession different from all other profession, and the question that profession are not included is already well examined during VP Santa. So profession as a principle are not excluded. But then a very categorical statement was made in the 8th para of Justice Gawai, order. It said that it can be considered. No, by the way, it is same thing what Justice Chandrachud told me during rejection of dismissal of my SLP, that it can be considered if there is a case, just like in this case, you have Mr. D.K. Gandhi, who is the aggrieved person. If there is an aggrieved person and there is a foundational background, then it can be considered. And in fact, this is the way forward for the fraternity right now. You have to read the para 8 of Justice Gawai to understand what I am saying. Now, this is next comes the Indian Medical VP Santa. We know all about it. I will skip it because I spent more time in other. We come to this Union of India versus N.K. Srivastava. It's very interesting. There is a controversy. The VK Santa very categorically said that even in a free hospital, if some patients are paying, then it would be the claim would be included within the Consumer Protection Act, within the ambit. So it this examine, there is a patient goes to Sarvodaya Hospital, her wife delivers there, and he's unhappy, brings his child who is not doing well to government hospital, that is Safdarjung Hospital. Later he finds fault with both the hospitals, both are negligent. The State Consumer Dispute Redressal Commission says that neither Sarvodaya Hospital nor Sarvodaya Hospital is not negligent, and District Commission said Sarvodaya Hospital is not negligent, and that the National Safdarjung Hospital doesn't come in the ambit of the consumer law. State Commission said that Sarvodaya Hospital is negligent and gave a reward of 2 lakh as compensation. But Safdarjung, it said that it is not within the jurisdiction of CPA. Now, the patient, the Sarvodaya Hospital went to National Commission, and National Commission said that nothing doing. Safdarjung Hospital may be government hospital, but some patients are treated private, so it is covered by the para 43 given the VP Santa, and he imposed 2 lakhs on Safdarjung Hospital and said Sarvodaya Hospital is not guilty of negligence, and their order of compensation of 2 lakh was set aside. Now, when it went to Supreme Court, again, this order is authored by Justice Chandrachud. He writes very well. That's why I am mentioning his name. He said that as far as Sarvodaya Hospital is concerned, okay, not negligent. But as far as Safdarjung Hospital is concerned, we will not go into the question whether it is negligent or not. But the question is whether it will come in the ambit or not. We cannot deal with this question also because we don't have the facts given in the affidavit, which was presented before the National Commission. Those are not verified. So actually, according to VP Santa, if you read carefully, it is written if bulk of the patients are treated free, are treated as private patients, and if minority only are treated free, then it would stay included within CPA. So Safdarjung doesn't come in that category actually because bulk of the patients here are treated free. So, but the court was in no mood to resolve this controversy in this and kept this question open. This question is open according to this judgment, and also remarked that the NCDRC determination that Safdarjung Hospital is included is not to be used as precedent. This is the significance of this judgment.
Sir, one question is there. Means so doctors who are working in the free government hospital, whether services are rendered free, whether they come in CPA or not.
No, they don't come under CPA.
Okay.
They but the case can be filed against them. There can be writ petition against them. Civil case can be filed against them.
Okay. So
They
moving
don't
ahead,
come under CPA, but they
yes.
are not free from liabilities.
Okay.
Civil case can be filed against them.
Okay. Okay, thank you
Yeah.
sir for that. So next issue, what we come always, and in every medical legal talks, we hear about documentation, communication, complication management. And we have so many judgments related to this documentation, communication, this complication management. So I will invite our panelist, Dr. Satish Tiwari sir, to correlate these judgments with our how to redefine our practice with these judgments. Dr. Tiwari sir, please.
Thank you, Dr. Hemant, for giving me this opportunity, and Dr. Minaj Sheikh. And also, I thank our senior pediatricians all over India who have joined today's webinar. And as we have seen from the discussion with what Dr. Baldava and Dr. Pradeep Arora sir has said, what I think we will discuss this recent judgments. But most of the times now it is clear that the judgments given by the various courts, whether it is a district consumer court or whether it is a state commission or national commission or even Supreme Court, though most of the judgments are well analyzed by the various commissions and the court, but we can see how they go on changing. So whether many times we have to think whether these judgments are really well analyzed, especially after that advocate judgment regarding whether they are included under consumer court or not, and why the doctors have not been removed, as Dr. Pradeep Arora sir has said, that it was discussed that individually you have to come if you are affected, and then Advocate Gawai, the present Supreme Court Chief Justice. So I think the judgments are basically very confusing, and the reason for that we do not have time to discuss. But for our today's attendees and those who are attending, the delegates, the documentation is the best way at present to prevent or to have the proper judgment in medical legal cases. The communication skill is very important, and based on these too many cases will be decided. So we will see few cases. The recent judgment, this is Nazrul Sheikh versus Dr. Sumit Banerjee. This is 2024 judgment, where there was a allegation of negligence during cataract surgery, which was a post-traumatic cataract, and after surgery there was complete loss of vision because of the retinal detachment. The district commission ruled in favor of the petitioner, Mr. Nazrul Sheikh. The case went to the West Bengal State Commission, which overturned the decision, and then National Commission is again upheld the decision of the West Bengal State Commission. So the case finally went to the Supreme Court, where Justice Vikram Nath ultimately allowed the appeal and reinstated the judgment given by the District Commission. So this is how it has changed from District Commission to the State and National Commission, and ultimately the Supreme Court. So according to the Supreme Court, failure to communicate and document the complication of retinal detachment went against the doctor, and the negligence was held. The another judgment where Mr. Neeraj Sood versus the Jaswinder Singh, again decided by Supreme Court in 2024. The allegation of negligence in 6-year-old child who had corrective surgery for ptosis. Punjab State Commission dismissed the complaint for worsening ptosis. National Commission partially allowed, and Supreme Court again overturned the National Commission judgment of worsening of ptosis. So the post-surgery care was proper and does not indicate the medical negligence. So this is all based on the communication and documentation of various events which have occurred after surgery. So I think for our colleagues, it is very important to understand that whatever has happened either during surgery or before surgery, whether the investigations were done or not, or the complications which have occurred post surgery also, it has to be documented properly. Documents have to be maintained for about 3 years as per the National Medical Commission guidelines, and these documents can prevent various cases going against us. So please maintain your document properly, document the things, communicate the things. The third case is again Supreme Court judgment of 2023, where there is allegation against the Shivertech Hospital and Research Center, where there was dispute in nasotracheal intubation and removal of the endotracheal tube after that. So according to National Commission, nasotracheal intubation is obsolete, leading to the medical negligence, so it should not be done. But Supreme Court says nasotracheal intubation, the procedure is not obsolete, and dismiss the National Commission order. In Mr. M.K. Khambata versus Venkatramana Nursing Home, again the Supreme Court in 2022, where Mr. Khambata has suffered tibial fracture, was admitted to the Venkatrama Nursing Home, and a corrective surgery was done and implant was inserted. He was declared medically fit and started resuming work, but implant snapped, and subsequently the case went to the court. The National Commission dismissed the claim, ruling that insufficient evidence to establish the negligence, and Supreme Court also subsequently upheld the National Commission judgment that subsequent twist or fall in snapping of the implant does not prove negligence on the part of the hospital. So this is how we should document the things so that things can be defended at various levels. In this Mamta Agrawal versus Bombay Hospital, the National Commission judgment in 2022, where the Mamta Agrawal, who was representing Mr. Vijay Kumar, who has suffered the injuries after falling from a ladder. This case is from Amravati only, and the court has ruled here that the post-operative hypoxia was managed properly as per the reasonable standard. The affidavits of doctor in support of the hospital were unchallenged by the patient's relative, and there was an expert opinion from Maulana Azad, which also did not point out negligence on the part of the hospital. So again, the documentation was perfect and the negligence was not held in this case. So I think like this, our judgment should be proper. These are some of the old judgments, 1984 and 1967. So I think there is no need for this judgment, but we have to keep in mind that the present judgments, they are very much in favor of a proper documentation. So I request our colleagues to have a proper documentation and communication skill. Thank you, Dr. Hemant, for this.
Thank you, sir, for that discussion. But then important word from him, sir, is that whatever he communicates should be documented, and documentation helps in defense in the court of law. The next issue, which is all related to vicarious, which is related to vicarious liabilities, and this vicarious liabilities is what is a vicarious liability? It's a legal concept where master is the responsible for the actions of the employee. So master may not have committed the act, but the employee. So we work in the hospital setup, corporate hospital, and we have the staff working under doctors, and so residents and in the hospitals working. So I will invite Dr. Mahesh Baldava sir for his take on this judgment to explain vicarious liabilities. Maybe in short, sir, because we have a lot to discuss. Yes.
Thank you, Dr. Hemant sir. As explained very well, vicarious means someone who is junior in the ladder is doing work for you under your direction and supervision, and you as a senior and a responsible person is held responsible by legal fiction that since you are a decision making authority, you are liable for all your RMOs, your workers, nurses, subordinate staff, whatever negligence they commit, then also the superior or the boss is responsible. So we have all these judgments. Now next slide, which will describe in the case of Kamineni Hospital versus Swami, the National Commission, they slapped 15 lakhs to the doctor because even though everything was fine, the anesthetist was employed by the hospital and the patient developed the complications and hence the patient died, and that is the reason the National Commission thought 15 lakhs for. So 5 lakhs and 5 lakhs from the doctor. The hospital challenged this ruling, arguing that the negligence claim was not supported by medical literature or expert. The Supreme Court upheld the liability and reduced the compensation from 15 to 10 lakhs, citing disease, most modest salary and future earning potential. So it much depends upon the what the person who is claiming is asking. It is as per the multiplier rule under MECT, and the court noted that the hospital has already deposited 10 lakhs and plus whatever interest which accrues, it comes to 15 lakhs. So that much was allowed. 15 lakhs were reduced to 10 lakhs. Next. In this case, the Indian Air Force and the superior officers of army officers, meaning those in the medical profession which are in the Indian Air Force, they in this particular, the Ashish Kumar Chauhan, he filed a case that he received HIV infected blood in 2014, and vicariously IAF, Indian Air Force, was liable for 1.55 crore, and they slapped 1.55 crores compensation and to be paid to the Chauhan for mental agony, trauma, and medical negligence. It highlights the deficiencies in blood banking, in licensing and testing procedure. So, next one.
Yes.
Bombay Hospital and Asha Jaiswal. This Dinesh Jaiswal, he himself was a doctor and he was suffering from aneurysm of aorta, and it's suddenly went into dissecting aneurysm and causing lower limbs to become blue, and impending gangrene was there. But at that particular time in Bombay Hospital, all the operation theatres were busy with other patients, and even though this patient needed the surgery urgently, it was not made available. So the Supreme Court quashed the order which had slapped 14 lakhs plus on Bombay Hospital for not providing the operation theatre. They said all OTs were occupied with other emergencies. How new emergency patient will have to wait? So it is not all the time, it should be available only. And this Chandalani's case, Methu Setupati, even basically this is a case where the medical team failed in their duty to take care of the demise Naveen Kant, and the appropriate medical care, unfortunate death are not attributable to negligence just because for subsequent post-operative care, this was related to kidney transplant. The patient was not admitted to the same hospital where the kidney transplantation occurred. They went to another hospital, and then subsequently they said that the hospital which they went next, that was not authorized for kidney transplant. So Supreme Court said it is not necessary, and they failed to substantiate the claim of the negligence. So hospital was not vicariously responsible. These are two old cases, and they are in Achyut Rao case, state of Maharashtra. These are criminal cases. Actually, in criminal cases, vicarious responsibilities are not fastened. But since it belongs to state, the Chandrika Ben with a mop was left by civil hospital. Subsequently, it was removed in the government general hospital Aurangabad, and then the 36,000. And again, they said that public hospitals are responsible. So, as I told you, high courts and Supreme Courts, they can travel from any law to any law, from criminal to civil and whatever they want. So it is not necessary that vicarious responsibility is not applied to the criminal law. The second case also is a criminal law case only. Medical negligence was occurred because of the exchange of gas pipes by a ward boy in a medical college, Indira Gandhi Hospital in Shimla, where thinking that it's oxygen, but the anesthetist gave to the two patients like Ram and Rakesh Kumar nitrous oxide, and they died. And 1,30,000 were awarded, 1 lakh deposited in the court registry, and emphasized the importance of accountability in the public healthcare and a precedent for the compensation in the cases in medical negligence. So, all in all, if the dean or the state or the superior boss, they are responsible. The employer is responsible for all the problems which are caused or medical negligence which is caused by the employee. In most of these last two cases, you can see the state were generally state is sued when there is death occurs, and secondly, vicarious responsibility is never invoked. But in both these cases, the vicarious responsibility is invoked. So, and this last case is also again once upon a time a celebrated case. The highest claim till the Prasad Nangas came, the Nangas case came as 1 crore. There was 17.5 lakhs up to 2001 or something like that. And Arjun Singh Walia, the minor, was admitted for fever, and he was to be injected with chloramphenicol IV bolus, but 5 ml chloroquine was administered stat, and patient developed cardiorespiratory arrest, revived, but child developed mental retardation and cerebral palsy. And for this, the nurses and the subordinate staff, they had provided the care, but then, and the doctors, but ultimately the hospital, Spring Meadows Hospital, was held responsible, and they had to pay 17.5 lakhs compensation. So this makes amply clear that for every act, the hospital or the state or the government hospital is responsible for paying the compensation for negligence done by the subordinate staff, even including doctors, nurses, and other staff members.
So,
Thank
Dr. Baldava sir, the question is in peripheral practice, also in other practices, a small nursing home we have. So, are we responsible for any mistakes made by the nurses as well as the any RMOs employed?
Yes, you are responsible in your private hospital also. First of all, they should sue your hospital or organization. If you are running a clinic, the name of the clinic. Then secondly, you are the boss, you are the decision maker, and you are under your guidance and under your supervision, your staff is working, whether they are RMOs or they are nurses, whether they are qualified or unqualified or partly qualified or whatever the case may be. So eventually your organization or your banner under which you are working, and you yourself will be responsible as a boss, because you are the person who is supervising for these people.
Thank you, Dr. Baldava sir, for that. Our next issue is with our infrastructure availability. While we manage the cases at our hospitals, sometimes we realize we require some higher gadgets, or higher system, or higher infrastructure. So, while practicing periphery, we may require sometimes ventilator or higher modalities. So, how to correlate? There are so many judgments which says about the infrastructure availability. So, I would invite our Dr. Pradeep Arora sir to explain about what does infrastructure availability means and how do it correlates with the peripheral practice where such higher gadgets or higher modalities may not be available. Sir, please.
Yeah, this set of slides deal with those judgments in which infrastructure was an issue. And I may make it very clear right in the beginning that infrastructure by definition in court of law includes the personnel, the staff, the human resources, also in addition to equipments, etc., all of which have been mentioned. Now, this first judgment, Bombay Hospital, I think we can go to the next slide because we have to short of time, and let's cover them fast. Now, this Bombay Hospital Medical Research Center, this has been already dealt by Dr. Baldwa in Vicarious slides. Yes, here there was problem of operation theater. There was also complaint about the non-availability or digital subtraction angiography, which delayed the operation by 12 hours. And patient says that that was detrimental. That lead to myonecrosis and ultimately to septicemia and death. So that has been dealt. The judgment part has been dealt by Dr. Baldwa. Now we come to next. Now this is the genre of High Court, Superior Court proceedings, many of which you have witnessed during the COVID period, wherein the High Court of the state takes on a kind of executive function, and through daily directions passes order to create synergies between the different arms of the administration for expeditious delivery of healthcare. So, of COVID, we know that in all high courts it happened. One of which we fought in Nagpur also, when there was capping of the healthcare charges during COVID period. Now, in this particular, what happened? There is set of orders which are given on different days. This is just 1 day order that we are talking about, and just like Parmanand Katara, there was a news item that Mr. Pramod Kumar, he died of RTA, and when he went to different hospitals, he was denied admission because of non-availability of bed for diverse reasons. Therefore, non-availability of bed or ventilator or some at CT scan, he went to all, Ramanoyar, Lohia Hospital, Tegh Bahadur Hospital, and Lok Narayan Hospital, all big hospitals of Delhi, of National Capital Territory. So the directions which were given in this were regarding the infrastructure only. And what were those? That they should recruit the personnel so that there is adequate strength, and recommended triple P model for high-end machinery, which is difficult for the government to afford in sufficient number. And also, it recommended formation of a nodal agency dealing, which is an emergency treatment authority. So all these recommendations were made, but the underlying, factor that was responsible for this proceeding was that there was lack of cooperation between the Lieutenant Governor and the then GNCTD, that is Government of National Capital Delhi. So the court was just trying to create the synergies. Next. Now this is a very informative judgment. Harish Kumar Khurana is an anesthesiologist. So the case was admitted, in hospital. Dr. Harish Kumar Khurana gave the anesthesia on 9th. This was of bilateral kidney stones. On 9 December, first surgery was done on one side, left kidney, uneventful. And on 16th, second surgery was done. But after second surgery, at the end of it, the patient developed, cardiac arrest, and was not able to bring. The consciousness was not regained. The patient was shifted to ICU, and within 2-3 days time, that is on 23rd, in fact, she breathed her last. Now, National Commission said that there is here the infrastructure issue was that ICU was not available in the hospital. She had to be transferred to CCU, coronary care unit. So this is not acceptable. If that surgery was undertaken, if this facility was not available, then the surgery should not have been undertaken at that hospital in the first place. So for that deficiency, 17 lakhs plus 9% interest was awarded. In Supreme Court, it said that when first surgery was done and it was uneventful, then how you can say that second surgery cannot be done? So second surgery was done, and if there is some accident and the complainant has not, and this is very important, complainant has not produced any material to prove that there has been actual some deficiency in the therapy which has been given, in the anesthesia that has been given, and the way the case has been managed after the cardiac arrest had occurred. So no fault has been complained by the opposite, by the complainant in that regard, and no expert opinion has been, no material has been placed. So therefore, this will not be regarded as negligence, and so it was set aside. Next. This is also deals with the availability of ICU. This is a very contentious issue, that when patient dies, and many patients go for litigation if they are shifted to an ICU after they become serious in a smaller hospital. So this is a very important point. So one should be wary of it and wary of this situation, and one should try to avoid such situation. That is, if there is suggestion that things are complicated, one should not admit the case in small hospital in first place. That is much safer. Now, in this case, it is similar case. Vijay Sinha is actually the diseased person only. She was having fibroids, bleeding profusely, hemoglobin 7 gram%, and she was hypertensive too, so bleeding all the more. And on 1st December 93, she was operated, and she again had to be shifted to ICU, and few days later, patient died. So there was a criminal complaint also. The husband was a trade union leader of Whirlpool, and you can imagine what can happen. There was criminal complaint also, which gave its opinion in 2005, and State Commission in 2005 only awarded 3 lakh compensation to the complainant, saying that what was the hurry in doing surgery? You should have stabilized the patient. The hypertension should have been corrected or controlled, and anemia should have been corrected. But this was then National Commission said that no, they have produced the material. Surgery can be done even at the hypertension 110, and according to their perception, they have the patient is bleeding, and unless you treat her and remove her fibroid, she will continue to bleed. You will keep on giving blood, and she will continue to bleed. And surgery, they have shown the material, placed the material on record, that it can be done even at 6 gram. So they have taken one course which is acceptable to a reasonable and proper body of doctors. So therefore, they are not negligent, and then set aside the order. Now, what happens in Supreme Court? Supreme Court says, all right, they took a course which is acceptable to reasonable and proper body. But why did they operate the patient, such a compromised patient? They were taking a risk. Why they operated the patient in a hospital which is without ICU? And that is where they lost the case. And the compensation was enhanced to 5 lakhs with 10 litigation costs. Next. So the moral is, if a patient is compromised, this is surprisingly old, well known. Who doesn't know about this judgment? Who knows even one sentence about medical jurisprudence? He knows about this judgment. But surprisingly, this judgment is the most misquoted judgment I have seen. Even during the arguments in High Court, the Advocate General I found was misquoting this judgment. And this judgment, the people have drawn inference that you have to deal with emergency anyway, whatever be the merits of your skill, your qualification, and your resources. No, that is incorrect. Not that, yes, it is a professional obligation to deal with the emergency. Our IMC regulations write that you have a duty to assist the patient who is in need. The word means assist, not treat. Treat only the competent person can treat. So you have to treat the emergency within the bounds of your skill, your training, your resources, and your experience. Only if you feel safe. Otherwise, no point in dealing the golden hour. So the judgment goes like this.
Yes.
You know all this well. That there was a scooter accident.
Yes.
PIL was filed. I will make short of it. And then the court said that it went into the Indian medical, ethics 2002 has come later. This is 1989 judgments. That time it was 78 regulations, I think. So, but those are similar and the clauses are similar. There is a professional obligation to provide immediate medical aid to a patient in need, but to the extent of your capabilities and your capacities, not beyond that. Not that you have to stabilize the patient. This is the clause which have been added, by in the clinical establishment acts, but this has been made directory even in the statutes, and 201 law commission also explains it this way only. And if you read the judgment, only it said that the treatment should not be delayed because of medico-legal hassles. This is what exactly happened when when the victim went to the doctor, first doctor. He denied that their medico-legal procedure can't be done, sent 20 kilometers away, and on the patient died. So it gives multiple other directions which are in favor of doctors. For example, the doctors will not be harassed if they have not done the proceedings. Doctors will not be called to courts for trivial reasons, and if called, they will be freed, at the earliest minute. So this is what the judgment is, but it is a very misquoted judgment, highly misquoted judgment.
Sir, one practical question for you, sir. If we
Mhm.
practice at periphery and we have asphyxia patient, is it mandatory to have a ventilator while managing hypoxic babies?
No. You should refer. You see, if you are keeping that patient, holding that patient, if you are holding out that you can treat that patient, then it is your responsibility that you should have the wherewithal to treat that patient.
Okay.
But if you are saying at the threshold only that please don't waste time, and you have to assist if you want to act in good faith, go with the patient and see to it that he reaches the right center.
Okay. Thank you, sir.
I will add to it, Dr. Hemant and Dr. Pradeep Arora, sir.
So we
Will I
should.
add to for whatever the information, there are two basic things come, that of course within the bound of your qualification and competence and skill, but you have to just stabilize the patient. You have to stabilize the patient.
Sir, there is objection with the stabilized word is not there in this permanent Katara.
No, permanent Katara
This
is
is
not there, but
artificial injection. No. There is no word like stabilize. You have to take professional obligation to
they have
attend
said
that patient, to
human
assist that
life is
patient.
insurrectable, and
But
hence
not to the point of stabilization. Stabilization cannot be ensured. Even in the best hands, in every case, serious case, stabilization cannot be ensured within minutes. Even if you are you are a cardiologist and there is a cardiac patient, you cannot make sure that within few minutes the patient will be stabilized. Leave alone a patient, a person like me, pediatric surgeon.
I'm putting a rider to it.
Probably that
I'm
point
putting
is.
a rider to it. Whatever you are telling is absolutely correct. I am just adding the stabilization to the extent of maintaining the respiration, pulse, and the blood pressure.
Yes.
And you shift the patient to
Yes.
appropriate place.
Yes, sir.
So we are. This is of course my interpretation, but limited to maintaining the hemodynamic stability, nothing more.
Yes, sir.
Dr. Hemant,
Yes, sir.
I think I agree totally with Dr. Pradeep Arora, sir. It is very difficult in medical science to say which patient will get stabilized,
Yes.
when he will get stabilized. So even if he is a cardiac patient, respiratory patient, or simple trauma and blood loss and hypovolemic shock, nobody knows how much fluid he will require or how much blood transfusion he will require for stabilization. So I think what Dr. Arora has said, basic of Dr. Permanent Katara case or the decision is that the emergency treatment should be provided.
Yes.
Like if
Yes.
the child, if the patient is bleeding or if there is a blood loss, you can apply something to take care of the blood loss and put a IV line
Let me clarify, sir.
Yes.
Permanent Katara only says that medico-legal procedures or formalities will not come in the way of discharging your professional obligation of treating the patient in emergency. Full stop.
So we have to give emergency treatment and refer the patient to a proper center.
This is okay, but what Katara says that medico-legal formalities will not come in the way. That's all.
So the take-home message from this is that whatever emergency patient comes, try to whatever treatment first aid you can give, but arrange the transfer. And the best thing is always accompany the patient and get it transferred to the appropriate place in appropriate manner, in appropriate way. to be on the safe side. So let's move ahead. Thanks, sir, for that interpretation. And let's one more terminology in our medical legal is res ipsa loquitur. So what does this word means? It means things speaks for itself. There are a lot of judgment of the case. What I want to ask from our expert, Dr. Baldavar sir, while doing what precaution we should take and the way out if such incidents happens is, and please, we have little time short, please be precise and be concise on this all to explain this terminology in view of this all judgments which are there.
See, res ipsa loquitur in the court is a court which, when you do not give the evidence, the court substitutes the evidence of negligence or whatever the evidence needed to complete the circuit of negligence. So mostly it is done in the cases where it is obvious that you left the mop or needle or instrument, given the wrong injection or wrong route of injection, wrong limb is operated, wrong side is operated, wrong patient is operated. Generally, where the courts are ready to apply res ipsa loquitur. Now, in this recent judgment, the first case of Beruman versus Madhusudan, in this particular case, basically multiple visit, the surgeon assured the hospital that they revealed the end of thalmitis and there was a complete loss of vision. So in the district forum, Pune initially dismissed the case, saying this is a complication only, end of thalmitis, a normal complication. It was reversed by the state commission, and national commission, they said, later overturned this ruling, attributing the infection to appellant's alleged mishandling of post-operative care. However, Supreme Court said that the surgeon failed to detect and treat the infection in time, which led to the end of thalmitis and irreversible damage to the vision. So they applied on the basis of res ipsa loquitur, because basically the doctor remains silent in his pleadings as to how and what infection. He did not even say this was a sterile inflammation. He did not even speak that it is infection which is caused by patient's own negligence, or so there was complete silence between the infection and the cataract surgery which he did. So that is the reason later on the Supreme Court said that because you have not detected the infection, documented, and infection was treated in time, so they applied res ipsa loquitur. In this Jyoti Devi Suket Hospital, a needle was left in the anterior abdominal wall while performing a surgery. So District Consumer Mandi, that is Himachal Pradesh, 5 lakhs were awarded. State Commission, they awarded 1 lakh, and National Commission announced to 2 lakhs. Later reduced the amount. So after 5 lakhs, it was reduced to 1 lakh, then again 2 lakhs. And the Supreme Court restored the original compensation, rejecting the application of eggshell rule. But this eggshell rule and res ipsa loquitur, there is something common in the eggshell rule, like diabetes, hypertension or cardiac disease or your some other pre-existing disease. You cannot plead and say that because of this happened. You have to take care and control of that. Like in that Vijay Sinha's case, there was a low hemoglobin, hypertension, etc. One has to take care and then proceed. So in this particular case, the leading to prolonged suffering of the appellant, that is the reason the Supreme Court said, like it's a concept like res ipsa loquitur, and the needle which remained, that kept on troubling the patient, and that's the reason they applied eggshell rule, and they granted what was granted by District Forum Mandi 5 lakhs. They retained this thing. Next one. Then this Shoda Devi's case underwent DNC, that is for fractional curettage, and IV was given. Most probably it is not mentioned in the judgment, but instead of the vein, it has gone into artery, and it has caused blueness and then pain and gangrene, and patient hand had to be amputated. So the state commission said there is no problem, and the national commission granted the 2 lakhs of compensation, and saying that applying res ipsa loquitur. The Supreme Court upheld the NCDRC ruling, emphasizing the hospital to take care of serious consequences of medical negligence, that is but the original application of res ipsa loquitur was done by NCDRC. Next. Sheila, in this case, the phimosis patient, baby 2.5-year-old, operated for circumcision, and post-operatively patient vomited and developed respiratory distress, and that reduced the baby to the vegetative state. So District Consumers Forum, they gave compensation of 5 lakhs, which was enhanced to 10 lakhs by National Commission, and subsequently it went to the Supreme Court. They enhanced by another 7 lakhs, and that making it 17 lakhs for this vegetative child. So applying again the principle of res ipsa loquitur, that since the surgeons as well as the anesthetist did not explain what caused the respiratory distress, they said aspiration. Then the Supreme Court said you should have taken care of the child, should not have aspirated, and you have not taken all that care. So they applied res ipsa loquitur without understanding what was the nexus between, because according to the Supreme Court, in first place the aspiration should not occur because child was empty stomach, and they should have given all the medications to avoid vomitus and aspiration. So that was there. And these are the two old cases from Andhra Pradesh. Both are from Andhra Pradesh. Both have that there is a health complication because the mop. One is the surgical towel, and another one there was again mop only. And in the first case, 8 lakhs were awarded. Next case, 20 lakhs were awarded. Now in this case again, since it was an obvious leaving a foreign object in the abdomen, that is a mop, res ipsa loquitur was applied, and they were given the compensation. So this, anything else, Doctor?
Yes. So, what is the way out if something happens?
Okay. Now, basically, what we do in our pleadings, that we write, please do not apply with our pleading with we should be, because in the consumer case, what happened, the cross examination is not there. So we give our explanation, literature, expert witness, eyewitness, and we also tell the consumer forum that in case of any doubt and any clarifications, please give us a questionnaire and answer there in lieu of cross examination.
Okay.
So this is the standard clause we put in our pleadings. So there is because in most of these cases we found that suddenly some court is applying res ipsa loquitur, next court is not even bothered to do that, and they just don't go into the pleadings and do not question what has happened, what is the cause-effect relationship, causation and proximate clause, nothing, and they just just out of some they bring in this, import this particular piece of evidence which is created by them and say that the doctor is negligent. So that is the reason to take proper precaution, we should make a pleading and saying that we have explained, these are our papers, this is our expert witness, eyewitness. Eyewitness is equally important, and this is our. So even in the cases of where the mop is left, wrong side, whatever surgery is done, whatever the cause-effect relationship may be there, whichever, at least we'll try to reduce the impact of what is obvious wrong, and then questionnaire that to at least you'll come to know who is at fault, and what is the extent of fault. And so many times, even after the retention of mop, patient never dies. The mop is simply removed by the next surgeon, nothing else. So patient is alive. So if the patient had gone to the previous surgeon, the previous surgeon will do it free of charge.
Yes, sir. Yes. So thank you for that, sir. But practically in pediatrics, we should be very careful of putting IVs and checking that IVs, because most of the res ipsa loquitur in our pediatric practice is IV causing extravasation and probably gangrene. That is the commonest cause we see in our pediatric practice. The other cause in the incubator ICU care, whenever this temperature is there, so we should be little bit worried about there should be no heat injury. Burn injury. That is one more thing which we should be careful. So these will come in the res ipsa loquitur cases. So because of
you have a case subsequently in your slideshow.
So because
Margashis versus Dr. Mayur.
Yes, yes. So because of this time constraint, we'll just move ahead, and I will request my panelists to be just brief and concise. We have two more issues: contributory negligence as well as the transfer responsibility. I'll request Dr. Tiwari sir to explain about these issues along with the judgments what are there, contributory negligence as well as the transport responsibility.
Thank you, Dr. Hemant. Now, contributory negligence, if you want to understand, it's basically very simple thing. Most of the times there is allegation against the doctor or the hospital that they were negligent in managing the patient. Now, contributory negligence simply means the negligence on the part of patient or their or his or her relative. So if you are told something to the patient that this has to be done, you have to be kept nil orally, or there has to be some investigation has to be done, or particular treatment is to be done. And these precautions are to be taken, especially after surgery or after the discharge. And if the patient or relative do not take that precaution, amounts to contributory negligence. And in such cases, as Dr. Hemant has asked, what defense we can take. So the contributory negligence is the best defense to dilute the allegation of negligence on the part of doctor and the hospital. So can we move to the first slide? That is Supreme Court judgment of 2022, Dr. Arun Mehra versus Muralidhar Chabari, where there was allegation of negligence after the coronary artery bypass surgery, where the gangrenes of the fingers of the left arm then developed as a post-operative complication. So in this surgery, the gangrene of the two fingers were there. The state commission dismissed the case, saying that it was because of the chronic diabetes. The National Commission directed the hospital and doctor to pay 7.5 lakh compensation along with the 20,000 for expenses for the litigation. The Supreme Court upheld this judgment and said that there was no negligence either on the part of appellant or the respondent number 2, because the coronary artery bypass surgery was not responsible for the gangrene of the finger. So there was no problem due to surgery. It was basically because of the contributory negligence on the part of the relatives for not taking the care. The next judgment. In this also, where the Odisha State Consumer Commission 1993, so it is an old judgment where a hysterectomy operation was done and the hospitals were and the doctors have given proper adequate post-operative care. However, the State Commission dismissed the complaint, ruling that the medical team has followed the standard procedure and the complication was not attributable to the negligence. And this judgment was again upheld by the National Commission. So I think we have to be very careful while defending any case. We should be able to find out what was the on the part of the relatives, whether they have not followed our post-operative recommendations or guidelines, whether they have not given proper medicines or the things which we have told them to give, or if they have not come for regular follow-up. So all this will amount to contributory negligence, not taking proper dose, not following the incidents or the various indications or various things which we have told them. So they should follow the guidelines. Otherwise, it will amount to the contributory negligence. Next.
Sir, this is also one of the case. Hansalas was Dr. K.H. whereas self-medication by taking dose of steroid. So we should also ask the history of self-medication also, na sir?
Yes.
Yes.
So all this will amount to contributory negligence.
Yes, sir.
Then as far as we have already discussed, especially in the permanent Katara again, that if the patient is not of our specialty, after giving the, after stabilizing the treatment, the best option is to transfer the patient to a proper center. So, case in this, the National Commission judgment of 2024, where there was allegation of medical misconduct and gross negligence by leading to the death of the patient, where the air embolism, a known complication after hysterectomy, the transfer of the patient was delayed to a proper center, leading to the death of the patient. So I think if there is any complication and it is not possible to manage at our setup, should be referred to proper case. In this case, again, there was allegation of negligence of Mrs. Salma Khan, who became brain dead during the treatment, and the patient was admitted for the concerns about the fetal movement. So she was taken for emergency cesarean, and during that the complication occurred, which resulted in severe hypoxia and brain damage during the procedure. So the complication of hypoxia, and the patient should have been transferred to a proper hospital, which was not done. And while transferring, I think we already discussed, proper care should be taken. If we are transferring, it should be to the proper tertiary care center, where the things which were not available at our place should be available. And while transfer, we should take care that the patient is managed properly. If there is need for the ambu bag and endotracheal intubation, that should be done. And while transferring, the hospital or the setup to which we are transferring, it's always better to discuss with them whether they have available bed or not. Otherwise, what happens? We transfer the patient goes to that hospital, and they say that we do not have any bed and you go to some other hospital. So like this, patient keeps on moving from one hospital to another, and by that time the patient deteriorates. So whenever we are transferring, the patient should be, first we should discuss with the hospital where we are transferring.
Thank you, sir, for that. So let us move to the next issue, the delayed treatment or referral. I will ask Arora sir to explain this. Be brief and be fast because we have the time constraint. Dr. Arora sir, are you there?
Yes, I am. Am I audible?
Yes, sir. Yes, sir. Please
Okay.
carry.
So this is about the delayed treatment and referral. You see, in every judgment, actually there are multiple issues. We have put these under this category, but doesn't mean that in these judgments or in these cases only these were the main issues. Only these were the issues. But yes, these were one of the important issues. I must make it clear. Now, in this is a 72 years old Mr. Uh, Pankaj Toprani is relative. But Ranjit Toprani is the patient, 72 years old. Surgery for sigmoid colon carcinoma, that is resection and anastomosis, is done. And on the very next morning, patient develops, becomes unconscious, develops convulsions, develops bradycardia. At that point of time, he is in post-operative ICU. This is Bombay Hospital Research and Medical Center, and it has got a post-operative ICU. At that material time was having post-operative ICU, and there was a different ICU, main ICU at 12th floor. So but there were convulsions and bradycardia, and there was a registrar available at that time. He was clumsy in putting the tube, and then he called somebody from the neighboring coronary care unit, and he put the tube. Meantime, some period was lost, and the patient became unconscious. Now, after that, patient went to vegetative state, remained for 8 months in hospital, and after 3 years, patient died. So now the allegation was that there is delayed treatment because of non-availability of senior staff, and that's why there is there is this complication and injury. State Commission dismissed the complaint, saying that, well, there was a doctor, he has put the tube, and patient was already in ICU, and then after some time, the cardiologist has come, neurologist come, everybody, the physician had come in actually in time. So if he was available, they were qualified people. You have not found any fault with the treatment per se over, so many days, but just, delay of super specialist reaching there. So this is not adequate. This was state commission contention. Now, national commission uh, said that uh, there was deficiency. The senior consultant was not there. Senior consultant, and those are not available. If it is an post-operative ICU, these should be available, and it was not fully equipped. The main ICU was there. The patient should have been taken to the main ICU because that is the only well-equipped ICU. Keeping him in semi-equipped ICU, this is the reason for the this casualty. Now, so. The order of state commission was set aside, and yes, the order of state commission, not this, same. So this was national commission dismissed it, and the order of state commission was set aside, and NCTRC awarded a compensation of 30 lakhs. Yes, a national commission said that fine. The cardiologists, all of them came late, but in their submissions they have not explained that what was the reason of bradycardia and what was the cause of convulsions, and the patient is entitled to have answer to these questions. And the judgment of Savita Garg versus National Heart Institute was quoted here. It is 2000 word judgment, that once the initial case is proved, then hospital has to come up with explanation that why such complication occurred. So since that is not there, then National Commission enhanced the compensation to 30 lakhs, and there was additional 1 lakh was to be paid by the doctors. So it did go to Supreme Court. It went from state commission to national commission and ended there. Next. The middle sentence is incorrect. The third one. Yes. Now this, Arun, this is the case of dengue fever, which went to Chirayu Health and Medicare Private Limited. And here, the patient was admitted in the morning. The count was 79,000, falling from 1.49 lakhs of, the day preceding it. And she was having abdominal pain for which the ultrasound was done. And in the evening, the patient dies. The complaint was that the doctors, the consultants, have not seen the patient and the patient has died unattended. The case went to Medical Council of India, which determined that the line of treatment cannot be faulted per se, whatever has been therapeutic measures have been undertaken. But the doctors failing to attend in time, not at all, is in category of misconduct. But the doctors were let off with just warning. Then state commission took a cue from this. And this is very important. Whenever the case has gone to Medical Council of India, and some information is available to the superior court or consumer court that some call has been taken by the Medical Council of India, usually they rely on it and go by it. So same thing happened here in state consumer. That they since the misconduct is there there was determination, so they have failed to follow the proper treatment, and they awarded a compensation of 6 lakhs. The moral is that when the case has gone to Medical Council of India, its outcome is always examined very closely by every court at every stage and is taken very seriously. So if your judgment in the Medical Council of India is against you, you should appeal and you shouldn't sit over it if it is against you, because it can translate into a bigger compensation in the parallel proceedings in other courts. The national consumer reversed the finding. I mean, again, not finding any, when it said when there is nothing wrong with the treatment per se, then not attending the patient only, how it can have a nexus with the injury to the patient. So there is a duty of care, there is a breach, and there should be a nexus with what has happened. So by simply not coming, you cannot say that injury has occurred when the line is okay. But the Supreme Court of India, they said that what should have been seen, that the treatment given was not in consonance with the either WHO guidelines or National Vector-Borne Disease Program. So for this reason, they enhanced the compensation to 15 lakhs.
Thank you.
So this is about the delayed treatment.
Thank you, sir. Very much. We are going to the last issue, and almost every time we in the medical legal talks we hear about prudent doctor, average skill, standard care. So these are the we have last few minutes left in our session. So these are the 1, 2, 3, 4, 5, 6, 7 judgments. 5 are the recent ones. 2 are the benchmark old judgments. I will request Dr. Tiwari sir to take up first 3 judgments.
Hemant sir, I will take first 2. I am aware about this personally.
Achha, you please take first 2. Then next 2, please, Dr. Pradeep Arora sir, and last one, Dr. Tiwari sir. Yes, please, but be very brief and concise.
Margashish, this patient, Dr. Mayur Mehta, this was a malnourished child who came with a diarrhea, and what is written, he underwent surgery that is for his gangrene. So an IV was put, and below knee amputation was done. Now Dr. Mayur Mehta, he obtained that patient. He said that patient in his clinic. He said the patient came in circulatory shock. He was having nails which were blue, and the amputation was done of below left leg below knee. On that leg, he has not put any intravenous fluid. The parents said that they were alleging that that's it. They are presuming that the IV intravenous fluid were put on that leg. In fact, it was not put. So, and he obtained some medico-legal expert opinion from cardiologists that in circulatory shock, there is a slowed circulation, there is the chances of gangrene, which can happen in situ also, and the blackening of the leg, which could have happened, but could have been saved, but then because of the original condition of diarrhea and severe dehydration and circulatory failure, it could not be done. So Consumers Commission then also awarded 5 lakhs for amputation. Meanwhile, here the leg where the gangrene has occurred, the IV was not ever put. That is the main contention of Dr. Mayur Mehta. Okay, then it went to the patient went to the National Commission, where it got delayed. This happened in the cases of 1994, and they delayed so much that in 2010 they got it got so delayed, they went to Supreme Court, and Supreme Court relegated back to the National Commission. And meanwhile, they filed a contempt terms. The patient agreed that whatever 5 lakh was given in the district by state commission, the district forum, the state commission, that they were agreed to. So they said they filed a consent terms and reached to a settlement. So here the question of proper care and fighting it out and giving all, even though the allegation was made that IV was put, there was no IV put. He got a expert witness where they said that in severe dehydration and circulatory failure, the in situ also gangrene can happen because of the deep vein thrombosis and whatever. Now this Rani Children Hospital and this hospital I know also, and their owners I know well. Here the patient name and the doctor's name is same. Only the Rajesh Kumar Jha and the owner of the Rani Children Hospital is also Rajesh Kumar. Now a premature baby where according to the patient they did not advise or screen for the Scottish screen for retinopathy of prematurity by ophthalmologist. That was the allegation. The patient developed blindness, and the parents claimed the hospital staff failed to conduct the necessary screenings. And of course, there was nothing in writing that they referred or called ophthalmologist. It's a big hospital in Ranchi. In fact, one of the best hospitals for children. So NCDRC found the hospital and doctors negligent and awarded to the parents 50 lakhs. So these two cases I know personally. So that is the reason
Yes,
I
sir.
had.
Yes, sir. Thank you. Thank you very much.
Yeah.
This one, sir, Maharaj Agrasen Hospital also. You
I
can
can tell my Maharaja everything.
Balram, sir, you can take.
Here again the no, you're in the previous, I think. In this also retinopathy of prematurity, baby was 1.49, was referred, not referred for retinopathy of prematurity. The parents alleged the hospital and doctors to carry out mandatory ROP check, and that's the reason the National Commission and the hospital are guilty of medical negligence and compensation were awarded. And Supreme Court upheld this ruling. Okay. Neil Mendoza, should I tell or?
No.
Yes,
Neil Mendoza, Dr. Pradeep Arora, sir. Please.
Okay, fine.
Okay. Neil Mendoza, this is a kernicterus developing after the pathological hyperbilirubinemia. There was G6PD deficiency, which was discovered 6 months later. But within 3 days, there was nothing to suggest anything sinister. The patient was discharged. And after that patient developed sudden hyperbilirubinemia and was admitted 3 days later and kept in the hospital for 10 days, and the whole full treatment for this hyperbilirubinemia was given. And later patient developed the syndrome of the manifestation of kernicterus full-fledged. So the patient blamed that initially the case was neglected. At the very outset, the actual treatment should have started, and demanded a compensation of 3 crore, 3 crore odd in compensation. Then National Commission dismissed the complaint, and mainly, they relied on the report. That's why proving that you have adhered to the protocol is very important, and the most convenient way of doing is, and most effective way of doing is, through expert opinion. Here, on the order of the court, a committee was constituted by the All India Institute, which went into the whole case and said that there nothing wrong was done. It was just providence that patient was having G6PD deficiency, and when there was rise of bilirubin, all of a sudden on 4th, 5th day, there was sudden hemolysis, and sometimes G6PD is not detected during that period. And for that reason, it was detected few months later when, according to protocol, the test was repeated. And the whole thing is unfortunate, but the hospital cannot be faulted. So that's how the complaint was dismissed.
Yes, I want to add just one thing to this, because this is a common scenario when the child gets delivered and at a maternity home examined by the pediatrician at a discharge. This case is from Mumbai actually, and this had a very long case. And mind you, on the day of the discharge, when the patient was examined when the neonate was examined by the pediatrician, in the clinical notes, he write yellowness up to the face and chest, and bilirubin was not done. And within next 36 hours, the patient returned with the yellowness, and the bilirubin came up to 45.
Yeah.
That much cannot increase. So it's a lesson to be learned that if you feel that yellowness is up to the chest, please get bilirubin done and then discharge. That is one important message. Although it didn't happen in anything, this was linked with the G6PD also, and the doctors got benefited just because of the AIMS report stating that G6PD test doing is not mandatory, or there is no guideline stating that, and that was the defense taken, and therefore anyway we will move, just because otherwise there more detail can be discussed. This one also, Dr. Arora sir, please take this Pavitra case.
Okay. I have to do it. Okay. This is a very interesting case, and very different case, because it is dealing with the criminal negligence, criminal proceeding for negligence. Now, the only fault of the doctor was that in a patient of diarrhea and vomiting, happening in a 13-month-old male, he prescribed the treatment at 10:25 p.m. in the evening and left to the staff nurses to give that treatment. And after he left the hospital, attendants felt that the patient is deteriorating. They created ruckus, and they insisted that staff should call the doctor. The doctor came at 5 in the morning, and within 1 hour the child died. And they ascribed the whole thing for doctor not attending it. So there was immediately a criminal proceeding was started, and those days Jacob Matthews judgment was not available. This is in year today. If it happens, then the course would be different. The medical board would be constituted. So it was seen by it was the issue was examined by a district medical board, of which civil surgeon was one of the members, and FIR was filed. It went to High Court under Section 482 CRPC proceeding for quashing the FIR. It was not done. And then later there is, when the charge sheet was ready, at that time, the application was moved under Section 258 of CRPC. It is provision available for summon cases when the cases are registered not on any complaint, that the Chief Judicial Magistrate can ask the magistrate on the behest, and after consulting the chief judicial magistrate, can discharge the victim if there is no merit in the case.
Yes.
Victim, I mean the accused person.
Yes.
Then, but this application was rejected by the magistrate. It was also got rejected by the session court, and when it went to Calcutta High Court, by that time Jacob Matthews etc. all were available, and then in that light it was seen that 304A IPC would not be applicable. There is no recklessness. He has done what was being done normally in their hospitals. And again, why negligence? Because the patient has been able to show that it is a fact that doctor didn't come, but patient could not show that any wrong treatment,
Yes.
improper treatment was given after because the doctor didn't come. So that material was not available. That's why the proceeding was this charge under 304A IPC on this ground was dropped against the doctor.
Yes, sir.
So this is
Yes, sir. Thank you very much for that, sir. The important lesson from these case laws, as well as what we practice in our pediatric practice when we are having our nursing homes or we are having patient in the hospital, if we get a call from any staff, or if we get a call from our registered RMO working at our hospital or any staff, we should go and try to attend the things. Otherwise, the things sometimes get worsened and you are said that you have not come in that time. So it is always better to let it be. If it may not be serious one, whenever any call from hospital is come, we should not neglect, we should not ignore, we should go and attend. So with this, these are the two old important judgment, but I think so we'll just keep this for the lack of time. If any panelists want to say something, one or two lines, otherwise we will move towards the concluding 2 or 3 slides.
I will just summarize that since we are done so much of work on Lakshman Balkrishna Joshi, the long bone fracture of femur, and patient should have been administered anesthesia, general anesthesia. Instead of morphia was given, and the doctor, both are doctors, Trambak Babu Godbole's son should have been given proper anesthesia, whereas the Lakshman Balkrishna Joshi, it was fat embolism which caused the death. So then the Supreme Court held it was not the fat embolism, it was the pain causing the shock and death, and the doctor was held liable. And Alfred Bendick in this was a patient of pneumonia, 2-year-old daughter, where Dr. Arvind Chinoy, he was treating at Manimal Hospital in pneumonia, and the patient developed gangrene near her fingertips and spread to her hand and blocked the blood supply. So here, State Commission negligence on the part of the hospital staff, 5 lakhs were awarded, and the National Commission upheld the compensation and again challenged the order and appealed to the whole amount increased to 20 lakhs because it will have the lifelong impact of the amputation. So the Supreme Court enhanced. So in short, again and again we have gangrene, as you told, very, very, very important intravenous fluids, which are the part and parcel of a pediatric practice, and we should take care of IV line. If in case of doubt, please remove all the IV lines and do not keep on pushing. They might cause compartment syndrome, they can cause the extravasation of fluids, and they can even cause the gangrene. So any one of these things, and all are detrimental to the practice.
Thank you very much for that. And just concluding some important slides I want to say about regarding that. Just moving ahead, just some important slide. Case laws are always dynamic. It changes with time and upcoming judgments. And we have seen so much difference in the case judgment from proceeding from district to states to national to Supreme Court. So still the important ones which each one everyone who is practicing medicine should remember these four basic case laws which are very important. Martin D'Souza case law which says that it should be referred to the committee of doctor and not to arrest doctors. The second one is important, Jacob Matthew case which says always the onus of proving negligence is on complainant and the standard of care is defined in this case law. Reasonable degree of skill and knowledge is defined in there, and we should always stick to the standard care and standard protocols. The another case is the Suresh Gupta versus this case law also stated careless act is criminal only if there is a gross inaction or gross incompetence. Death due to error of judgment or accident should not be taken as criminal liability. One more important case law, everybody should read these case laws. Kusum versus this Kusum Batra case law, which laid down the 11 principles determining the medical negligence. So this is very important. 4 case laws one should always remember, and these are all case laws which I will not mention, but expert witness is very important in the consumer forums. So in very importance of that, absent of expert witness, maybe it's not in consumer court is a it should be there. So what is the crux of all these cases was what we study? The standard care, reasonable skill and care, error or judgment is not a gross negligence, and expert witness. This is the crux of all the medical case laws. And one should always remember this. BNS 2023 has replaced Indian Penal Code 1860. These are the very important section. You can get the replacement for the old IPC sections by the BNS section. You can just have these links and you get all the information of that section in the 11 languages if we just use these links. And one most important thing, whenever any anticipated, you think of any complication or any litigation, please discuss the issue immediately. Research the literature, what is for and against, preserve the papers and appropriate documentation lifelong. And why? Because period of limitation act is 2 years. So after any incidence of negligence, the patient has 2 years in consumer, 3 years in criminal to file the case. And one doesn't remember what happened. So always research these things and keep with us. And I always say,
Hemant sir, I would just previous slide there. The preserve the papers and appropriate documentation and pleading these things all in your written statement. That is the basic. The lowest court, all the evidence, all the written statement should be proper, because appeal, you have to challenge the whatever is wrong with the judgment of the lower court. So you don't have chance to bring in new evidence then. So the only chance to submit the evidence and written statement is in the lowest court. Afterwards, you have to just fight out the decision given by the lowest court.
Yes, sir. So as always, I say in most of the medical legal talks, these 6 words actually, if you can remember, please try to anticipate when you are practicing OPD, indoor, emergency. If unexpected complication scenario wise, one should be mentally prepared what to do. The most important is the documentation, which should be a justified, informed one. Communication should be always the informed, which should be documented. We should always practice according to our qualification, infrastructure, ability, and capacity. I'll try to follow 4 principles of ethics: respect, do good, do no harm, equality. And always, last word, I always like to say introspection. At the end of the day, we should always audit our prescription and we'll always think about the patient being in our foot of our near and dear ones, what we would have done for the treating those patients if that would have been my relative or my near ones. So these 6 words, while practicing, probably will make the things easier in life and make the stress-free practice. And with that, I thank all my panelists, as well as extremely sorry for all the glitches which I faced, because it is a heavy rains and the electricity going on and off. So sharing was a problem at my end. So extremely sorry for that. Thank you very much. And thank you, Meena Sheikh. Thank you, Dr. Sanjay Pakmode. Thank you, Dr. Amol Pawar, for giving us the opportunity to share our thoughts at this MAHAIP platforms. Thank you very much.
Dr. Meena wants to say something. Dr. Meena Sheikh, you are ask him to unmute.
Unmute.
Yeah. Good evening, all. This has been an excellent session so far. I have attended in Medicolegal. The best of speakers as moderator as Dr. Hemant Gangolia. True to his name, he did the best. So also Mahesh Baldua sir, Satish Tiwari sir, and the Pradeep Arora sir. They have been the stalwart in their field, passionate and very eager to teach all of us. We sincerely thank you all, and I strongly believe that we should have more frequent such sessions. So we'll see how we can do that. With this, we close this session. Thanks a lot.
Dr. Yogesh Sarin want to ask. He has raised his hand.
Who?
Yogesh Sarin.
Okay, please go ahead.
He has raised his hand.
So I had asked this question in the chats also. Does vicarious liability hold in government hospitals also, where HOD and HO units, we don't employ the staff and we don't choose the resident that come through the NEET and all that? Hi, Dr. Arora. How are you? Can you answer this question, please? Dr. Tiwari, please.
Dr. Arora, Dr. Tiwari, anybody?
I will answer this question.
Dr. Yogesh. Dr. Yogesh.
Yeah, Dr. Tiwari, sir. Yes, sir. Go ahead.
If something wrong has occurred to the patient,
yes,
somebody has to take the responsibility, or somebody has to be blamed for that. And as you said, in government hospital, whether the junior doctors or the residents or the postgraduate student, whether they are appointed by the department or by the government, that's not the question, but they are under your training. And as Dr. Baldava has said, that the respondent superior is there. So whosoever is superior in the department will be held liable. So if something wrong happens during the treatment in a medical college, whether it is a government or private, if the junior doctors are there who are under training, they may not be held responsible unless and until it is something criminal wrong has been done. For any civil wrong or for negligence, the superior will be taken to the task.
Yeah, so my question is, I'm quoting an incident that had happened long back in 80s. A patient comes in shock, and those given times we never used to have long lines and all that, and cut downs used to be done. There are a lot of incidents where actually instead of basilic vein, brachial artery used to be cut. I remember lots such incidents ever happened. So sometime late in the night, 2 a.m., the junior first year or second year resident of MS General Surgery calls up, said that this patient has shock and I'm going to do a vessel cut down. And I asked him whether you know how to do it and you're comfortable, confident to do it. Yes, I can do it. I've done many. And he does it and cuts the brachial artery. And later on, I'm pulled into the case. I haven't chosen the person. The person at his level is supposed to be able to do basilic cut down. So I've done the right thing to kind of, delegate this kind of job for him. But he does the complication. So why should vicarious liability come to me?
Dr. Sareen, I think you are talking of a departmental action. Departmental action is different.
No, not the departmental action. It went to court.
It went to court.
It went to court.
Sir, it went to court, and one more incident, sir, same thing happened where the head of department was held responsible when the head of department was not present itself there. Yes, sir.
I wasn't present. And I have not asked him to do a surgical procedure which he was not supposed to be doing at that level of competence.
Yes.
Another example could be that I tell my post MCH assistant professor or associate professor to do a hernia, and complications happen. I'm head of the unit and I've been into the business for 40 years. But if the complication happens about the hernia, I'm pulled into this. I never chose that assistant professor to work with me. He's supposed to be knowing how to do a hernia because he's been post MCH. Why should I be pulled into this?
So, Pradeep Arora, sir, do you want to explain? Please explain, then I will say.
Yeah, you see, as far as you are head of the department. The patient has come to your department. You have not selected the patient But when the patient has come to you, you have elected to treat him in your department. So to that extent, your responsibility exists. You have taken up the position of a department, and you are responsible for the conduct of the, for the conduct, performance, and the outcome. For you are supposed to, because supervise them. But I may make one thing clear, that respondent junior and respondent senior are the terms which are used in relation to vicarious responsibility. And usually it is an employer employee relationship, and usually, this vicarious liability is passed if the patient has come to respondent senior, and the respondent senior has deputed the respondent junior to do a particular job on his behalf, or respondent junior is acting on his behalf. So that is a very clear case of vicarious liability. But you will may not have vicarious liability directly, not as much in that case, but you will have some responsibility, a tortious responsibility, because you have undertaken to supervise that department, and the patient has come to your department.
Dr. Arora,
But
in all our admission in the government hospital, I mean, I've always been teaching institutions like MAMC, LHMC. It is very clearly written in the admission notes itself, which the patient's relatives sign, where it's clearly written that for whatever procedure this patient is being admitted,
you are absolutely right.
it is not going to be done by the head of the department or head of the unit.
You are absolutely
Any
right.
other doctor in the unit will be able to do it. So suppose I take a decision that this procedure can be delegated and this person is he should be comfortably able to do it. But
of course, yeah, please listen. If you have created this kind of document which defines your responsibility, of course it will come in your aid. But usually this kind of document is not, made and is not available. When it is not available, then of course some responsibility spills over to you. Although it will not be typical vicarious responsibility, wherein you will become even more respondent vicarious responsibility. The respondent senior is more responsible than respondent junior. That is not the case in your, because you are two independent, qualified professionals. He has undertaken the case on his responsibility. But yes, that you are working as a team. So as a team member, as a senior team member, the responsibility spills over to you to the extent your role is defined. But yes, if you have been exempted and excluded by creation of a document, that would be presented, and that will definitely help you.
Yes.
May I add to it?
Yes,
May I
sir.
add?
What you, sir, said
Can
to
I
me.
add?
Yes,
Hemant,
sir. Yes, sir. Yes, sir.
I wanted to add. See, ultimately, even he is himself an employee. So the organization will be responsible.
Quite right.
Yes.
He himself is employee.
Yes.
Yes, quite right.
So to make the thing simpler, whenever this thing happens in any government hospital, any corporate hospital, whenever the allegations are made, actually the full team has been taken to the court of law. But
usually vicarious liability is.
But whenever the summons come, you can just explain the things, what the role of yours, and it all depends on the court of law decide. That doesn't make you are main responsible for that. So whatever the extent you are involved, or whatever the extent of the role, that you have to document, and that you have to prove in the court. That is important. And that the creation of that document, what you said, is that can be done. But whether it is valid in court of law or not, that just decide.
Definitely, every document would be valid. Of course, it carries weight if such document is created.
Yes. Yes, Minas.
Dr. Yogesh. Dr. Yogesh.
Yes, sir.
What I feel, I do not know how many other panelists will agree, but in such cases, if you are working in a government hospital, I think the responsibility will go to government also. That
yes,
of course,
it will be the responsibility.
Why I'm asking this question now? I mean, it's very pertinent. Last 5 years or 4 years, through NEET, 0 percentile residents are being taken into the courses, thanks to the pressure from politicians. So we are getting very low quality residents to work with us. So even asking them to put an IV line, you're scared. I mean, now at the age of 62, after having served 40 years in the government, if I'm scared that the resident cannot even put a bloody line in the department and vicarious liability may come to me, I'm very scared. I feel I should take premature retirement, take VRS and sit at home.
No. That is
No,
not
but
the
you
solution.
see,
That usually
departmental may not be in court of law, but in department, you can be, there can be a pressure upon you because of the, departmental rules and regulations, which is an internal affair.
no,
So
and I
that
think
nobody can help. That is, something of the department, belongs to department.
No,
Doctor,
is it
In
you
court of
said
law,
is it a
this
criminal
is
case
not a
or a
typical
civil
case of
case?
vicarious liability.
Is it a criminal case or a
Yes,
civil
Minaz,
case?
you can take over.
Hello.
Criminal case to vicarious liability is very, very,
Then is
is
the
not a
case criminal or civil?
Yeah.
civil.
15,
Civil
it's
case, then
5
you are
past
yourself
11.
employee and it exempts you. In criminal case, the person who does it, he is responsible, whether it's senior or junior. Vicarious responsibility cannot be imposed in criminal cases. 7 except the state itself or Union of India.
Yeah. Good evening. I mean, it's 5 past 11, 6 past 11, and I
Yes.
believe that, this kind of discussion will always been there. So pardon me for my ignorance. I have only one question. That we have been talking that, the vicarious liability is also applicable to the government setup. Is it so? Because as far as I know, the consumer court is not applicable to the government. So when it is not applicable, how one is involved in the government and asked in the government setup? Or what are the mechanism in government setup for the accountability? That is just 2 questions.
May I? You see,
In
the
the
law
government
doesn't say.
hospital,
Yeah.
in the government hospital, basically whatever cases are there on that's partly there are some paid beds. On that they just, so you have to plead it well from beginning on part of your hospital that these are the percentages of bed which are free, which are more than 97%, and you have to give an affidavit of the head of the institution that 97% of the people are being treated free of charge across the board, and only 2-3% are being charged as a private patient, and that makes sense. No one, even in the Safdarjung hospital which was discussed, they did not file their affidavit stating that majority of the patients are being treated free of charge. So pleading is very important. In absence of pleading and affidavit, the courts are helpless to help you.
Dr. Arora, these are usually the civil cases, and we were talking about the 2 years thing, and within 2 years you have to file. A case that has been discussed at 5 different forums, including NHRC, was filed in a court after 15 years. And the lower court does not even summon me and pass a decision against me, which of course was not upheld by the courts above. But 15 years later also the court, so courts, they are very...
Yes. It is a delayed justice denied situation.
Yeah, I mean, they say, oh, he was a poor man, he went to different committees, this, that. So 15 years passed in the way, he didn't have money to come to the court, now allow it. So, and then I'm not informed for 5 years. And the lower court, without kind of taking me in confidence, passes a... So courts do all kind of things. So one has to be really, really careful while dealing all this,
Yes, sir. That is same thing. As a medical practitioner, as a doctor, we are always afraid of. But always I say, don't worry about this. These are a part and parcel. कुछ नहीं होता है. हाँ, अगर अपना डॉक्यूमेंटेशन और ये सब बराबर रहेगा ना, कुछ भी होने दो. सालों लगता है, लगने दो, कुछ नहीं होता है. जब तक वो पेशेंट भी कंट्रोल आ जाता है.
Documentation is very important. The rest, everything can be kind of...
Yes. Yes, Minas, please.
Okay, with this, we sincerely again thank our expert Gangolia sir and our moderator Gangolia sir and expert Mahesh Balduva sir, Pradeep Arora sir, Satish Tiwari sir. They have been stalwart in their field and really passionate about their expression with their knowledge and wisdom. Thank you all. Good night for the wonderful session. Thanks a lot.
Thank you.
Yeah. Good night.